This is Team Flexeril. My name is Eric Kalita.
Sonia D'Angelo.
Amy DeLuca.
Laura Conrad.
Mark Sikowski.
And this is our case scenario for Chapter 15. When the postal facility in Mercer County, New Jersey was found to be contaminated with anthrax in 2001, the local health department had no physician designated to examine the 1,000 postal workers or advise them about prophylactic treatment with antibiotics. It was a Friday evening when the local mayor asked for help from the state health department. He was told that workers should seek prescriptions for antibiotics from their own physicians. Local pharmacies quickly ran out of the drugs of choice, just serving the workers who were able to contact their physicians. Other workers started to panic. The administrator of a private hospital located a supply of antibiotics and arranged for local police to deliver them to his facility. That hospital treated postal workers for the next 3 days before the federal, state, and local governments were able to coordinate their response. This incident illustrates the need for government to be involved in healthcare and the need for advanced preparation to respond to disasters and efficiently mobilize resources from multiple agencies at the local, state, and federal levels.
National Electronic Disease Surveillance System, NEDSS. NEDSS is an internet-based infrastructure for public health surveillance data exchange that uses specific public health information network and NEDSS data standards. Health Alert Network ensures that each community has rapid and timely access to emergent health information. A highly trained professional personnel and evidence-based practice and procedures for effective public health preparedness, response, and service on a 24/7 basis. HAN is a strong national program providing vital health information to support the dissemination of information at a state and local levels and beyond. HAN also provides the opportunity for healthcare professionals to network and share promising practices and lessons learned related to partner communications and alerting.
The National Laboratory Response Network, the NLRN, the purpose is to run a network of labs that can respond to a biological and chemical terrorism and other public health emergencies. It now includes state and local public health, military, and international labs. The Metropolitan Medical Response System is the MMRS. It's an enhanced local health and medical response to victims of terrorist incidents and other public health emergencies.
The Strategic National Stockpile, or SNS, is the United States national supply of antibiotics, chemical antidotes, vaccines, antitoxins, and other important medical equipment and supplies. If there were ever to be a bioterrorism attack or a natural pandemic, the SNS would be able to supplement and resupply local health authorities that may be overwhelmed by the crisis in less than 12 hours. The SNS is run jointly by the CDC and the Department of Homeland Security. The American Society of Health System Pharmacists' statement on the role of pharmacists in emergency preparedness. According to the ASHP, the role of pharmacists in emergency preparedness is to execute pharmaceutical distribution and drug therapy management during disasters. The expertise of the pharmacist should be sought in developing guidelines for diagnosis and treatment of casualties and exposed individuals, selecting pharmaceuticals and related supplies for national and regional stockpiles and local emergency inventories and emergency preparedness programs, ensure proper packaging, storage, handling, labeling, and dispensing of emergency supplies of pharmaceuticals, ensure appropriate deployment of emergency supplies of pharmaceuticals, and ensure appropriate education and counseling of individuals who receive pharmaceuticals from an emergency supply in response to a disaster.
The National Disaster Medical System. According to the Public Health Emergency website, the National Disaster Medical System, and I quote, is a federally coordinated system that augments the nation's medical response capability. The overall purpose of the NDMS is to supplement an integrated national medical response capability. The overall purpose of the NDMS is to supplement an integrated national medical response capability for assisting state and local authorities in dealing with the medical impacts of major peacetime disasters and to provide support to the military and the Department of Veterans Affairs medical systems in caring for casualties evacuated back to the U.S. from overseas armed conventional conflicts. Examples of when one might utilize the National Disaster Medical System are in times of great national peril, such as national disasters, acts of terrorism, major transportation accidents, and technological disasters. The Medical Reserve Corps. The headquarters for the Medical Reserve Corps is in the Office of the U.S. Surgeon General. The mission of the Medical Reserve Corps is to engage volunteers to strengthen public health, emergency response, and community resiliency. It accomplishes this by enlisting a myriad of health professionals as well as other key support positions including chaplains, interpreters, legal professionals, etc. The MRC functions and roles varying from disaster relief to improving health literacy. To become involved with the Medical Reserve Corps, please visit the Medical Reserve Corps website. National Pharmacist Response Team. According to the U.S. Department of Health and Human Services, this organization's purpose is to prepare pharmacists, pharmacy students, and pharmacy technicians that are interested in counteracting any possible terrorist attacks. Individuals trained will be called upon to assist in a mass vaccination or chemoprophylaxis campaign. This is not a volunteer program, but operates more like a reserve corps in the military might operate. When called upon, members will be activated as federal employees and will be paid for their services. A major concern that you might have as a future pharmacist is how you can be of help to someone that lies outside your state of licensure. As long as you have stayed current with your training and are able to deploy your licensure and certification will be recognized by all states upon your activation as a federal employee and will have liability coverage and will be covered under the Federal Torts Claim Act, in which the federal government will be the defendant. And finally, the USA Freedom Corps. The USA Freedom Corps was disestablished in 2009 and is now defunct. It was created by George W. Bush in 2002 and promoted individual volunteer service opportunities both at home and abroad. Under this federal initiative, Bill Clinton and George H.W. Bush raised funds to help in relief efforts for victims of the 2004 Indian Ocean tsunamis. Though the USA Freedom Corps no longer exists today, key components are still up and running. These include the following: Volunteers for Prosperity, the Citizen Corps for Homeland Security, an umbrella organization in which the Medical Reserve Corps is a key component. The Freedom Corps office is now the White House Office of Social Innovation and Civic Participation. The President's Volunteer Service Award also still exists. Finally, you can still find the Freedom Corps Clearinghouse website at serve.gov.